Hi, everybody. My name is Chris Gellert. I'm a physical therapist and a personal trainer. I'm here today with Pain Care Labs, and we're doing a webinar on staying active when you're older. And we're going to be talking about some great information that I think is not only useful, but applicable, and I can use it immediately. So what we're going to be talking today, before I talk about our topics, I'm a physical therapist for 21 years. I've been a personal trainer as well for 21 years. And I have an inpatient, outpatient, private practicing industrial rehabilitation setting experience. And we're going to be doing this webinar on the various topics covered here, which is effective exercise, types of exercise, getting started with weight training, importance of stretching, talking about what is osteoarthritis, and then why is VibraCool so important? And I want everyone to know about what VibraCool product is because it's a great product. So some background information: baby boomers are living longer. It's just fact. Why are they living longer? Because they have more knowledge, they're eating better, asking more questions, and really exercising, not maybe the right way, but are exercising in general, but need to do more in terms of the right way of exercise and the most effective way, okay? So when I talk about exercise, exercise is and has been shown to do a lot physiologically for the body. One, it's a great way to get in shape. It helps tone the body. It helps when you're overcoming an injury. It physiologically lowers your blood pressure and improves heart vitality. So lowering your blood pressure is something we all need, whether you're 30, 40, 50, 60, or even 70 or older. Something as simple as beginning walking 3 times a week can do just that. Lowers your blood pressure, improves your heart rate, and also improves your heart vitality. However, exercise comes in different shapes and forms. Whether you're into yoga or Pilates, I want to talk a little bit about various forms of exercise or types of exercise. So yoga has been around for a long time. Yoga is static poses, which improves flexibility of the lower body and upper body, works on improving stress or reducing stress, and improving core strength and stability. When it comes to Pilates, Pilates is more about improving core strength. There's not a lot of evidence that it really works on reducing stress, but there's probably a factor or an effect that it does. Walking is something simple that you do and doesn't involve any cost to you. Walking outside like it is here, it's about 55 degrees. It's gorgeous in Massachusetts or wherever you are. And that, again, taking a nice walk for 5 minutes, 10 minutes, 15 minutes, or even a little bit longer has shown to decrease your blood pressure, decrease your heart rate, and improve the heart vitality. Strength training. Strength training meaning lifting weights, some kind of weight, not just a can of soup, but a weight or a dumbbell. We'll talk more about this today. Tubing, bands, improve muscle strength, improve bone strength, CT or connective tissue strength, which we lose as per year. So I don't know if you're aware of that. We lose bone and our strength of our bone every year. So strength training can change that. It can actually revitalize our body and change back time. It can also improve our muscle tone, how we look, how we feel, but having more energy and vigor. And finally, another type of exercise is aquatherapy. Great exercise in the water. You can do it vertical, which again, here in this picture is exercises for the arms, for the shoulders, for the trunk, or you can do exercise that's involves swimming, which is flat or horizontal. Not as much fun. I've done vertical exercise or aquatherapy classes. I'm only 51. And let me tell you, I think it's amazingly effective. It's very effective from a flexibility perspective. It's new, it's different. And swimming is boring to me. It's just doing one thing over and over again. But when you're putting on a belt, a weight belt or a tube, and you're in the water in the shallow going to deep in the deepest, it does make it quite a bit of a challenge. It unloads the spine, it decreases blood pressure, it decreases, again, the heart rate. It makes us feel good, and it's analgesic. It's great. So the Journal of Sports Physical Therapy is a journal in our field as physical therapy, did and has done various studies on exercise. Exercise can be very, very beneficial for those with osteoarthritis, which I'll talk a little bit about today. If you've ever had hip and knee pain, you may not be getting enough exercise. So exercise in terms of regular walking, in the pool, like I said, land-based exercise, all actually have been shown to reduce load, reduce stress to the joints, those being the weight-bearing joints, the hip, the knees, the spine. So it also helps those with type 2 diabetes, or out there if you have cardiovascular disease. So continue on reading and listening, and you're going to learn a lot about exercise today. So getting started with exercise, how do we get started? Let me ask you a question. Have you ever exercised before? If the answer is no, well, you've got to start somewhere. If you've exercised, said yes, then it's really maybe rebooting yourself, doing a new program, getting going, getting motivated. And the big picture is, where do you begin? Well, you begin with knowledge and education, information. That's powerful, right? Start with a plan. Write out a plan. What's your plan? And your plan is, what are you trying to accomplish? What are your goals? Whether it be weight loss, getting in shape, toning, whatever the plan is, write it out. Write out your goals. So one thing I'm recommending for all of you out there today, start with a walking program once a week, progress to 2 times a week, ultimately 3 times a week for 10 to 15-minute bouts. That's according to the American College of Sports Medicine, which is really the gold standard in exercise and in our world as physical therapists when it comes to scientific research. Getting knowledge and gaining knowledge about exercise is really fundamental, because the more you can learn, especially from a physio and a personal trainer such as myself, you're going to be able to take that and get empowered and use that immediately. Second, you want to purchase some new workout sneakers. Sneakers are like tires. They wear out. So if you have some old sneakers that you haven't used in a while, it might be time for a new pair. Just something to think about. So again, a nice pair of workout shoes is going to be important for supporting your foot, supporting the arch, supporting the whole entire kinetic chain. So it's important to spend time with the sneaker store to understand how your feet need the proper support, because everything begins with the foot. Because when the foot hits the ground, everything changes. Maybe you have foot issues like bunions, or you have plantar fasciitis, or you've had a tendinopathy or tendonitis. It's important to tell that representative, the sales rep, about your feet, about what's going on, to help you. Here in Massachusetts, there's a store called Marathon Sports. They're very, very, really good. And the staff is really trained in the types of sneakers, the construction sneakers, foot dysfunctions. So if you can find a Marathon Sports in your neck of the woods, it'll help you. Getting the right kind and type of shoes / sneakers for the level of exercise you're doing and planning on doing is vital. You wouldn't want to take a pair of walking shoes and go running. You wouldn't want to take clogs to go hiking. So whatever your goals are, whether it be just walking, to get back into fitness, to work out, or really get into exercise regime, you need the right pair of sneakers. That's the bottom line. So I put 3 up here today for all of you to see. Brooks is a great company, solid, been around a long time, and they are some of the best. Nike, can't go wrong with Nike. Nice construction in the rear foot, nice arch, and then Asics. Now, these are also running shoes. So again, look at the brand, look at your budget, and what are you trying to do? What are your goals? If you're looking to get into jogging, these are really 3 great running shoes that can help you. If you're looking to get into walking, New Balance has a great pair of shoes, or New Balance is a company that makes walking shoes. So do some homework, research what you're trying to do, and listen on. So today I want to talk a little bit about walking shoe anatomy. You can see here that walking shoes are different than running shoes. Walking shoes, most importantly, are built differently. Walking shoes fit differently. And really, walking shoes are priced differently. So walking shoes are less expensive than running shoes. Running shoes tend to be more money because there's more bells and whistles. But if you look at the shoe construct, they're a little more rigid. Walking shoes are. The rear foot, which is the back part of that gray area, is a heel. And the heel, if the heel is really flexible, you're going to roll your ankle. So you want a strong or pretty stiff heel for a walking shoe. And then the midfoot, which is the center of the white, is your arch, which you need support. So every time you walk, that your arch doesn't collapse. And then the forefoot, which is the beginning of the shoe or front of the shoe, has to have a good toe box, which it has here. So the uppers in front, the rears in the back, the outsole. The outsole is the outside construction of the shoe, and the midsole is the actual where the heel is that ties into the actual Achilles. The collar that wraps around the actual heel, and then laces or Velcro. How does it fit? And how does the tongue conform to your foot? So whether you're walking or exercising or running, it's important. One thing I bring up and talk about today, which is stretching. Why is it important to stretch? Because when you walk, when you run, when you exercise, you're actually burning calories, which is great. You're toning the body. Muscles are getting shorter and tissue is adapting, and cells, which are inside the muscle, shorten. So if you keep doing exercise and walking and walking and running and weight training and don't stretch, all of that tissue adapts, which could put pressure on joints, and that can lead to pain and create muscle imbalances. So I have 3 to 4 simple stretches here that I want you to try on your own time. First is called a quad stretch. You're standing. If you can't stand up, do it on your side in your bed. Pull your heel towards your buttocks. If you can't get the heel, use a stretch strap, like an OPTP stretch strap, or possibly use a rope or a bed sheet. Hold the stretch for 15 seconds. A lot of the research I've read abroad when I was in Australia is effective as 30 seconds to 45 to 60 seconds. So 15 seconds is effective as long as 30 or 45 or 60. Your call. The bottom stretch, that is a lunge. That's actually getting more of the hip flexors. You're just dropping down your weight and your body weight to the floor. The top right, again, is a hamstring stretch. You can see this person's really flexible. Most of my patients that I see are very inflexible, and tightness of the hamstrings causes compression to the spine, which actually loads the spine. So important to have nice flexible hamstring calves so that the spine doesn't get that load and compression. And then finally, IT band stretch, which is raising across. And the IT band is tissue that connects from the hip bone to the knee bone. So some important tips. Start with a walking program, incorporate stretching and strengthening. Stretch, stretch, stretch every time you exercise. Incorporate weight training twice a week. Recovery is important. That's active recovery and passive recovery. Active recovery is doing something active. Passive could be like a leg compression sleeve. And don't forget to cross train with yoga or Pilates. Now, when it comes to weight training, working out, I want to break this down into two things: push versus pull. Push movements are movements that are the foundational movement patterns, such as opening a door or opening a car door. I'm sorry, opening a door or pushing a cart, excuse me. So the chest muscles are primarily used. The triceps, which are back here, are being used, as well as the hamstring and glutes, the muscles that are pink in the backside, and the hamstrings are on the back right below the gluteus maximus. Pull movements, like open your door, are foundation movements that include lifting groceries, picking up, opening car door, control walking the dog, are pulling motions which use what muscles? The rear deltoid, the lats, the latissimus dorsi, which is your back muscle, outer back, your glute and hamstrings again, but your biceps. So it's important to work the push muscles versus the pull muscles, or have them equally balanced. We'll talk about that. Did you know that there are muscles that are prone to tighten? Those muscles are called postural muscles, according to Vladimir Yanda, who was a physiatrist who did a lot of his life's work on research on muscle imbalances. And he found that muscles that tend to tighten are the muscles that are called postural muscles. They're the upper traps in purple, lower back, IT band, that purple muscle right by the gluteus maximus, and the hamstrings, calves. Muscles that are prone to weaken or get weak, he said, were phasic muscles. They need to be strengthened. That'd be the middle back, the rhomboids, the low traps, the gluteus maximus, the triceps. Rows doing this is going to work your middle back. Pull downs is going to work your low traps, which are your muscles below your back muscle. So again, did you know your upper traps right here? I want everyone to take your hand behind your back, head on your head, hand on your head, and gently lean and pull down. That's called an upper trap stretch. That feels so good. That addresses the upper traps, which are right here, where people hold stress from work, from life, kids. And it's important to stretch the tight muscles, not strengthen them. The rhomboids or middle back are phasic. So as I said, they can be strengthened, and how you can do those are with row exercises such as bands. It's important to have balance and symmetry within the muscles. So getting started, how do you get started with weight training? Well, you need some light weights. You don't need a lot, 3, 5, 10, 15, depending on your goals. If you want to get bigger and more muscular, you get bigger muscle or bigger dumbbells. But if you're trying to tone and get in shape, you don't need a lot of weight. You need a firm, supportive chair. You need a yoga mat for stretching, some motivation. And the other thing that I use when I'm at home, because I'll be going back to the gym soon, is some tubing. Tubing is called TheraTubing or resisted tubing. Comes in different flavors, almost like lifesavers. And the different colors of this resistance are different bands of level of tautness. So maybe you get like a red, which is light, and a blue, which is a heavier band, for example. So weight training 101. Muscles need 40 to 48 hours of rest or recovery every time you work out. So if you're working out and doing chest or arms, they need 24 to 40 hours before doing them again. Program design refers to how and muscles to work out. I created a full body workout for you here today, which is simple, especially for the baby boomer out there listening, versus doing chest and arms day 1, back and shoulders day 2, and legs day 3, which is something else you can do. That's a different program or program design. So a full body workout consists of something like this. In place squat, we all know what a squat is. You can do body weight first. Then you can start adding weights and holding it to your side and just squatting down. This first exercise in the blue with this gentleman pulling with the band, that's called a one-arm row. Pulling up towards his back works the latissimus dorsi. That's a pull motion. Lunge, which is the pink, the woman with the pink shirt, that works the gluteus maximus. It works the hamstrings, glutes, and the quads. You start doing sets of 10 of all these exercises, and I'll talk to you about how do you progress accordingly. The next exercise is shoulder press. So that's doing weights overhead. Don't do shoulder press if you have a torn labrum, a rotator cuff tear, or a shoulder that has been dislocated or has a total shoulder replacement. Always talk to your doctor and your physical therapist before designing and working out with a program. These are some general guidelines. Standing mid-row is, again, an exercise I said earlier for your middle back. It's a postural exercise because those are phasic muscles. And then you've got seated side raises. Side raises work the deltoid muscle right here, which is a muscle we need for lifting a child, lifting bags, and they weaken over time. Bicep curls, as a picture on the right, works the bicep. And finally, tricep extension or doing kickbacks work the tricep, which is a weaker muscle compared to the bicep. The core is made up of 29 muscles. So bridging simply is lifting your buttocks up off the ground while your knees are bent. That's called a bridge. So the bigger picture is you want to start with exercise for doing 10 reps, 1 set of 10, 1 set of 12, 1 set of 15, 2 sets of 10, 2 sets of 12, and then start to add weight if your goal is to general conditioning. So here's some examples of push and pull. Chest, again, is push, shoulders push, triceps, some exercise I just covered, chest press, overhead press, skull crushers where you're lying on your back, and push-ups, dips. Pull, doing barbell rows. You could do dumbbell rows. Dumbbells here and pulling up towards your chest. Instead of using a bar like he's doing, use dumbbells or a band. And also pull-ups. Legs, again, there is a plethora of exercise with legs, but that could be from deadlifts, squats, which we covered, lunges, diagonal lunges, and forward lunges, or in place and doing traveling lunges where you're moving. So just to clarify, push versus pull, I hope this helped you. So let's say you're done exercising. What do? You need to stretch, not before, after exercise. Stretching improves the elasticity of the muscle, decreases muscle soreness, which has been shown physiologically, reduces tightness, and it feels good. It's important to hydrate and restore that which is called homeostasis. Homeostasis means where the body is balanced. Ingest some protein versus carbs. That's going to help you refuel and what you lost. Usually it's 0.8 to 1 grams per kilogram. So talk with your doctor, do some research online about how much protein you need to take in and how much carbohydrates post-exercise. Now, something that is common is drinking coffee in the morning. What is osteoarthritis? I'm only 51. I have a little bit in my spine, a little bit in my hip. My hip has no pain, but my back has some. So I have to deal with it. It's life. Did you know that 60% of Americans will have a back injury in their lifetime? So that's more than 150 million people will have a back injury or some inflammation or possibly of the hip. So osteoarthritis or inflammation of the bones commonly affects the spine, the hips, the knees, and the weight-bearing joints. So you can see here on the left, the actual spine is normal, and someone with an osteoarthritis or arthritic spine, there's spurring, or there's actually a decrease in space. That space is due to compression and possibly due to overbearing for the load. Knee arthritis is on the bottom here, and knee arthritis is caused by repressive, such as excessive weight, excessive load, and also repetitive stress to the joint where the cartilage is lost. I apologize. That's my wonderful dog, Skylar. So he wants to chime in. I apologize. What causes osteoarthritis is, like I just said, the weight bearing, excessive load, type of work, someone's job, lifestyle. Those are all typical causes of osteoarthritis, and aging is part of it. We're all aging. We can slow this down by improving mobility because motion is lotion. Some symptoms of osteoarthritis are redness, swelling, stiffness, and pain. Typical arthritis I see with my patients is in the morning, they're stiff. During the day, they feel better with movement. Movement is ideal. Motion is lotion. In the PM, they feel sore and stiff, maybe achy. Best thing to do if you know you have arthritis is talk to your doctor. Sometimes your doctor will give out non-steroidals, but medicine is not the only thing to help with osteoarthritis. Knowledge, information, see a physical therapist. We can do a lot. You never want to never ignore these symptoms of osteoarthritis. Physical therapy is extremely beneficial for restoring mobility, restoring lost flexibility, restoring and helping improve strength and function. How do we do this? We do this through educating our patients. Physical therapy now is into a doctorate level where all physical therapists are required to earn a doctorate level degree. And like myself, I have multiple degrees and gone out of school training outside the US to become better and learn more. So again, I think physical therapists are very smart. We're experts in human movement, and we can really help you. So check out physical therapists through apta.org. That's www.apta.org to find a physical therapist in your neck of the woods. So we use patient education. We use manual therapy, our hands, to actually work on the muscles that are tight, the connective tissue that's tight, massage, stretching, and exercises, very effective exercises, and core strengthening. We have other things that we use in our toolbox, but these are the main interventions. So general advice, if you develop pain out there and you're exercising and it lasts 3 days, greater than 3 days, stop exercising. You want to ice for 3 days. So if it's your knee, for example, you want to ice and rest. The goal, though, is to keep moving, but not resume exercise or weight-bearing exercises, or jumping or running, or loaded exercises, which is resistance. After 3 days, then do heat for 3 days and resume stretching. If pain persists more than 7 days, it's time to see a doctor and give your doctor a call. One of the things that I found in working with VibraCool, if they've got, or Pain Care Labs, they have a great product called VibraCool. And VibraCool is actually an amazing product that I'm going to talk to you about today. So when we talk about injuries that from 0 to 7 days are called acute injuries. So 0 to 3 days, ice and rest, stop running, stop weight training, use VibraCool. What is VibraCool? VibraCool is mechanical stimulation that overrides pain fibers. How does it do this? In essence, it tricks the brain because signals go up the spinal cord to the brain where they're perceived, and then it goes down a motor pathway. This tricking is really not tricking at all. It's science. It's called the gate control theory. And the gate control theory asserts that non-painful input closest to the nerve gates to the painful input, which prevents pain sensation from traveling to the central nervous system or the spinal cord. The gate control theory of pain describes how non-painful sensations can override and reduce painful sensations. Pretty neat. So if you get hit in your hand, like by a hammer, there's fibers that are activated called A-delta C fiber. They go up to the brain, the stimulus perceives it, and then you've got swelling in your thumb, right? Well, what do? You rub it. You try to desensitize it, but you want to use ice. After 7 to 21 days, you want to continue to stretch. You want to walk. You want to use VibraCool. VibraCool works. Continue to use a stationary bike. Continue heat with stretching. And again, if the pain persists, still use VibraCool and resume walking. So what is VibraCool? VibraCool reduces inflammation, where the high frequency current vibrates, increasing blood flow to accelerate tissue healing. VibraCool is easy to use. The instructions are right on the box, which I'm going to show you today. It's affordable, and I believe it's on sale right now. Normally at $89.95, I believe it's $59.95. Check with paincarelabs.com. It's portable. It fits in your hand, the palm of your hand. Great for travel or home recovery and pain relief. You can see here, this person's using it on their leg. So you don't even need an outlet cord. So how do you use VibraCool? You open up the package. You unwrap the neoprene sleeve. Got a neoprene sleeve here. Okay. You've got inside the package the vibration unit. Open up the unit. You got an ice pack here, or ice packs. You place the ice packet behind the neoprene sleeve, and you put the VibraCool bulb inside the neoprene sleeve. And let's say it's your elbow. You turn it on, and you just wait. Simple as pie. 10 to 15 minutes, and that's all I got to do. The key thing with this product is that it's easy. It works. Pain Care Labs has research articles for those out there who are doubting that this works. It works. I'm a physical therapist. I'm used this product. I have it right here with me right now. It works. I've used it. So I want all of you to try Pain Care Labs VibraCool product. I want to thank all of you today for being and listening. And if anyone has any questions, we'll take questions now. I think we got a question. How frequently should you change your shoes? Great question, Nicole. And is it different than walking? So how frequently should you change your shoes is every 6 months, or roughly 500 miles. And it's not necessarily different from walking. It sort of is, because the shoes for walking are going to not be broken down as quickly as a pair of running shoes. So running shoes, I've talked to many runners as well as podiatrists and running physios, and running shoes definitely need to be changed very frequently. Walking shoes, if you can push the front to the back end and bend them, they're done. They need to be changed. Any other questions I could answer? Well, that was a great question. I want to thank Pain Care Labs. I want to thank everyone today listening to me. I hope you had a great understanding and this webinar made sense. If you have any questions, you can always email me at ptcg1999@verizon.net. Everyone take care and have a great day.